Hi everyone, I am Doctor Ravina, NHS doctor specialised in women's health, and I'd like to welcome you to this dedicated channel for women's health where we aim to educate, empower and inspire women on all things to do with their bodies. If you don't follow me already, check me out on Instagram, TikTok, and also share our video on YouTube with all your special people so that we can continue to disseminate evidence-based information. Now, if you have any questions, please drop them in the comments below and we'll make sure that we can produce videos for you so that we can answer all your questions. So let's dive straight in. Today we'll be discussing how to prevent a UTI. And I know firsthand this is such a massive issue. Not only did I suffer with UTIs when I was younger, I literally get people coming in every single day because they've got a UTI. So it's a super common problem, and at least 50% of women will suffer with UTIs at some point in their life. And UTIs do not discriminate. Children as young as 6, 7, or even younger than that can get UTIs all the way up to age 90. So whether you're male or female, a UTI may be something that you suffer with at some point. In this video, I'll be discussing with you how women can help prevent themselves from getting UTIs, specifically to do with how to improve their vaginal and vulval hygiene, and also what to look out for if you were to get a UTI. So what is a UTI? Well, a urinary tract infection, also known as a UTI, is an infection of the urinary tract. So what is the urinary tract? Well, it starts with the urethra, which is the hole that allows your urine to pass out into the world. And the urethra then leads up into your bladder. And if you get a urinary tract infection, this can become really inflamed and irritated, leading to a condition called cystitis. And if you don't treat the urinary tract infection, perhaps you're not sure if you have one or you're not aware of the symptoms, and sometimes some women just never have any symptoms. And if this happens, the infection can then lead up further to the bladder and reach the kidneys. And this is a condition called pyelonephritis, which is quite a serious condition. It will need hospital admission and we need to treat you with an IV, intravenous antibiotics and fluids, which is why it's really important to identify what a urinary tract infection is. So the most common symptoms that you may have are pain on urination, discharge in your urine, going to the toilet more often, so perhaps more so during the day, and also waking up at night to pass urine. You may see some blood in your urine, or it might look a strange colour, and it might smell, I think I mentioned that. And the key red flags to look out for are abdominal pain, specifically around your lower back and your flanks, because that could indicate a pyelonephritis, nausea and vomiting, not eating, not having an appetite, fever, rigors. These are key red flags to note, and that might suggest that your urinary tract infection is spreading up into your kidneys and becoming slightly worse. So if you do identify any of those symptoms, please do either go to your A&E or speak to your doctor. So now let's talk a little bit about how we can help you to prevent getting urinary tract infections to begin with. Tip number 1 to prevent a urinary tract infection is to urinate after sexual intercourse and to wash the vulval area before and after sexual intercourse. I have done a video on vulval health, so I will link that if you want to know a little bit more. So the reason why you should wash down below before and after sexual intercourse, and why you should urinate, is because during sexual intercourse you've produced a really nice environment for bacteria to grow. It's hot, it's sweaty, you've inserted a foreign object, being a penis, which may have bacteria on it, into the vagina. And that's a great opportunity for the bacteria to not only infect the vagina, but also the groin area. So the urethra is in very close proximity to the vagina, and it's very easy for bacteria to enter the urethra and into the bladder, causing a urinary tract infection. Not only that, we've got lots of bodily fluids around the area. So not only do you have semen, but you also may have vaginal discharge, you may have some blood if you're on your period, you may have some urine if you've just gone to the toilet, some fecal matter, some sweat. And it's good just to make sure that that whole area is clean, because the environment in which you've produced during sex means that bacteria that may already be there may have an environment to grow even further. So make sure you pass urine after sexual intercourse so you just get rid of any bacteria that may be entering the urethra. Tip number 2, wipe from front to back. So I've had a few comments actually asking whether this is truth or whether it's just a myth. And by doing lots of research, I've noted that there is clear correlation between prevention of UTIs and wiping from front to back. And the reason for this is because if you imagine the female anatomy, I can put a photo here, there are 3 holes down below. There are 3 orifices, which is a different word for holes in medical language. So you have your urine hole, which is a urethra, you have your vagina, and then you have your anus, which is your back passage. And these are all in very close proximity to each other. So if you have a sexually transmitted infection, that infection can cause urinary symptoms because the infection can easily infect your urethra. Similarly, any fecal matter that enters your vagina or your urethra can cause infections down below. So by wiping from back to front, you're actually bringing forward that fecal matter after you've done a poo down into your urethra. And with women, you have a shorter urethra compared to men. So the distance for the bacteria to travel to infect your bladder is much shorter, and that's why women actually get more urinary tract infections compared to men. Men have a very long urethra before it reaches their bladder, so usually the bacteria doesn't reach the bladder so often to cause severe symptoms. So when the bacteria does reach the urethra, it travels up the urethra, causes some local inflammation, then gets to your bladder, which then causes inflammation and cystitis. And just as you get any infection in the body, it recruits an immune response to start. And you then get white blood cells that build up in your bladder, and that can cause pus, which is sometimes why you get a change in colour and a change in smell of your urine. And that's just because you've got lots of white cells, lots of pus that's trying to fight this bacteria. Further to that, because you've got this infection in your bladder's sort of spasming. It's not sure what to do. It's got this foreign body, it's got this bacteria in the bladder, and it's starting an immune response. So it starts to contract, and that's why you get symptoms of hesitancy. Tip number 3, drink lots of water and make sure you're hydrated. The reason for this is because we want to encourage you to have dilute urine, so that we're diluting the bacteria so that it's not going to multiply and cause a big infection, which will cause you symptoms and problems with urination. What I do is make sure I have my big water bottle, which I usually refill 2 to 3 times a day, so I know I have my 1.5 to 2 litres of water. So I really do encourage you to make sure that you're tracking how much water you're drinking every day. And it's actually really surprising how little people know in terms of how much they're drinking. Something that I always ask is, how many glasses of water do you drink? And people are like, oh, I have 1 in the morning and maybe 1 at night. And they don't actually know how many millilitres or litres they're drinking in a day, which is really important to know, especially if you're someone who's prone to getting urinary tract infections. Also, if you do need to pass urine, make sure you do actually go. A lot of people hold in their urine, especially if you're on a long flight or if you're traveling somewhere and you don't want to use public toilets. I know one of my friends hates using public toilets, so will always hold in her urine until she gets home. But the reason why we shouldn't actually do this is because urine contains a waste product called urea, and urea is a toxic product that our body doesn't want anymore. So you should actually allow this to be excreted. You shouldn't hold on to it, because that will also mean that you're predisposing yourself to urinary tract infections. Tip number 4, foreign bodies. Now, foreign bodies can make up and look like many different things. It could be a foreign body being a penis, it could be a vaginal diaphragm, it could be dirty condoms, it could be sex toys. All of these things are foreign bodies that are being inserted into your groin area and have the ability to pass through your urethra to cause a bacterial infection. I will focus on the vaginal diaphragm. Now, some women use this as a form of contraception. It's not so common, but some women do use it. Now, the issues with vaginal diaphragms are that, yes, they do help with preventing a pregnancy, but the issue is that it is inserted into your vaginal canal. And this can cause a change in your natural flora of bacteria in the vaginal environment. The vaginal diaphragm contains spermicidal agents which kills the natural bacteria and the natural flora, which actually protects you from some urinary tract infections. If you have an imbalance of the good bacteria in your vagina and the bad bacteria, then the bad bacteria may actually increase and cause any infection, which is why things like vaginal diaphragms and lubricants that contain spermaticidal agents, which are agents that kill the sperm, can actually affect the woman in terms of not only causing UTIs but also vaginal infections and abnormal vaginal discharge. So those are my top 4 tips. Before we conclude the video, I'd just like to leave you with a few pointers on things that you shouldn't do. So the first thing is to not use scented soaps. So fragranced products, things that contain lots of chemicals, can not only predispose you to UTIs but also cause vulval irritation and itchiness and vaginal infections as well. So I would suggest using things like Dove or Aveeno products where they are unscented, unfragranced, really gentle and delicate products for down below. The next thing I would say is to not hold your pee. If you have an urge, make sure you go. Tip number 3 is don't rush urination. Make sure that when you're sitting on the toilet, make sure you fully empty your bladder, because if you keep rushing your urine and you're not fully emptying your bladder, you're going to have residue of your urine left in your bladder, and not only can that predispose to bacteria growing, but it's also quite uncomfortable for you, and it means that you'll have to keep going and you'll have urinary frequency. Number 4, if you have a urinary tract infection, it is advised for you to avoid alcohol. And the reason for this is not because of antibiotics. Most antibiotics that we give for urinary tract infections are okay to have with alcohol, but do make sure you check this with your doctor when you're prescribed antibiotics. But the reason why we say to avoid alcohol when you have a UTI is because it can cause irritation of your bladder lining. So it means that your symptoms will get worse, and also it may be harder to clear the bladder because the alcohol will disrupt the immune reaction that's happening in your bladder. Also, try and avoid sugary drinks. Drinks that have high sugar intake mean that you're going to take in more sugar, which means you're also going to excrete more sugar, and bacteria feeds on sugar. So don't give the bacteria more sugar it needs to grow and cause an infection. And lastly, avoid condoms and diaphragms with spermicidal agents, also lubricants that contain spermicidal agents. And this is because it can change your natural pH in your bacteria, and this means that using survival of the fittest, the bad bacteria will actually outcompete the good bacteria and cause an infection. So those are my top tips to help prevent you from getting a urinary tract infection. I hope that helps you, and if you've tried any products that have helped you to prevent a UTI, please share them in the comments below so we can help other women. Until next time, take care. Bye.